this computer. I have now turned on recording. Okay. This is August 22nd, and this is a conversation about proposals that the state is making regarding case management services in developmental disability services. Okay. Um, I'm going to run through some slides because I want to make sure that everybody kind of has the same information. Sometimes we call that level setting. It just means we all kind of have the same information. Some of this will be familiar to some of you, and some of it will be brand new. And then we want to leave plenty of time to take your questions. Okay. And then a lot of people, I presented this same talk this morning at 11 o'clock. And folks really wanted to have access to the slide deck, which I'm happy to do, but it would help me, and I'm going to ask Sue to capture this information because I didn't do a great job of it this morning, if you put your email in the chat, and then we will make sure that you get a copy of my slides. Okay. So I'm going to go ahead and share screen. And hopefully you guys are seeing, I don't dare, I have to use the, I don't dare make this more sophisticated than this, but are you seeing slides? Okay. So let's get to it. So I want to remind us of a little bit of the history of why Vermont is talking about case management services at all. Like how did we get here? And it's actually been a pretty long road. So back in 2014, which was 9 years ago, more than 9 years ago, the federal government's Office of Medicaid, which is called CMS, that's their initials, put out several important rules about how they wanted states to deliver home and community-based services. Now, these rules didn't come out of nowhere. They weren't, it wasn't any surprise to anybody about what those rules said. In fact, the federal Medicaid folks, CMS, had been working on creating these rules for at least 5 years before they actually published them and said, these are new rules. In fact, some Vermont self-advocates had a real hand in influencing some of the rules. And what was going on here, and this is kind of a little surprising because we think, gosh, we've been having community-based services for a really long time. But actually, it's not as long as you'd think. And the federal government had never actually defined what it was going to pay for in terms of community-based services. They knew what they were going to pay for institutional type services. They've been doing that for a long time. But the courts had found that people had a right to live in the community and be supported in the community and get services to do that. And that states needed to create Medicaid programs that would support people to live in the community. And Medicaid had never defined what that meant. So they engaged in a process to start to say, what is that about? And in fact, it was self-advocates that told them, and there was an important paper around this, that it's not so much about the building. Like, yes, it matters if the building is institutional or if it's more like a home. That's important. But it had a lot to do with how much control and choice people had over their lives and their families had over the lives of their loved ones, right? So really what mattered was the quality of the supports people were getting and the help they were getting to live the lives they wanted in the community. So that was kind of the big picture of what the Federal Medicaid Authority was up to when they published these rules in 2014. Now, there were several buckets for these rules, and one of them had to do with what they called person-centered planning. It had to do with how you plan your services. And that's the rule that's important in what we're talking about today. And that rule wasn't like something that was going to happen, oh, a few years from now, states, you should get ready to do these things. That rule was the law, was the rule, was the official thing you had to do, starting 3 months after the rule was published in 2014. And one of the things that that rule said is that a person who's receiving services cannot get their services, cannot get their case management services, the planning for their services, the monitoring of their services. They cannot get that from the same organization that is actually delivering their services. Right? Now, this was a big problem for Vermont. Vermont was an early adopter for creating home and community-based services. And the best thinking that people had at the time they set up Vermont's system was to create basically one-stop shopping. You would go get everything from your designated or eventually your specialized services agency. You would get your evaluation for services, your needs assessment. You would plan for your services. Someone there would coordinate your services, and they would deliver services like having a direct support provider to help you or a job coach. All of those things would be under one roof. Well, the Federal Medicaid Authority said you can't do that anymore. You got to spread out some of those pieces of what you're getting over more than one organization so that those organizations can act as a check and balance on each other, right? So I'm going to say a little bit more about this term conflict of interest. But basically what the federal government said is it's a conflict of interest to have an agency both plan and monitor your services and also be the agency that's delivering the services. So let me just do this. So what is this thing, conflict of interest? And sorry, my dog is about to go crazy because I'm home right now. So a conflict of interest is a fancy term that it talks about what happens when an organization that's providing you services or is helping you with something, it can't 100% be your ally because that same organization or that same person has ties to other groups that might need something different out of the deal. So this is easier to understand when we give some examples. But basically, a conflict of interest is when an organization or someone is kind of pulled in two different directions. So, for example, families often talk about not getting complete information about how to plan services for their family member because the agency they're talking to, it's not in that agency's interest to tell you could go to some other place to get some services, or you could do this other thing that might not be convenient for the agency. That steering you to certain services based on what's convenient or better for the agency is a conflict of interest. It's not putting the needs of the person receiving services first. Another example, and Levi, you might be familiar with this happening to some of your friends in self-advocacy, is when you have a problem with how your services are being delivered, but you might not feel safe and comfortable going to your service coordinator because that service coordinator also employs the direct support provider or the home provider that you're having a problem with. So they might not do what you want. They might do what, say, the home provider thinks is in their interest. They're not putting what you need first. So what the Federal Medicaid Authority says is when someone's services are being planned and arranged through their service agreement, That organization needs to put the interests of the individual and their family and the people that support them first. So that's why they wanted to get rid of this conflict of interest. And even the council, the DD Council, and I'm not here to tell you what to say about all that's happening here, but you know, the council's had a longstanding position that even though it's going to be a change, and change is hard, that people's rights are better protected when there isn't a conflict of interest built into our system, which is what we have right now in developmental services. So to go back to the history here, 9 years. This has been 9 years. Vermont spent several years arguing with the federal government and saying, yeah, that rule that you published in 2014, that doesn't really apply to Vermont. We have a different arrangement with your Medicaid, and that doesn't really have to happen here. And there was some back and forth about that. And eventually the federal government said, yeah, no, actually, that rule applies to Vermont too. All the other states are doing it. You have to do it too. And then the state of Vermont went through a process, had a lot of meetings with stakeholders, and they came up with this idea that they would propose to the federal government what we want in Vermont is a choice model. What that meant is people could choose whether they wanted to stay in a situation where their services were coordinated by somebody at the same agency that delivered their services. You could choose to be in a conflict of interest situation. You could stay the way things were, or you could choose an independent case manager. And the federal government came back eventually and said, no, Vermont, sorry, this is about protecting people's rights. It's not a reasonable choice for people to opt in to experiencing this conflict of interest. We're not going to okay this choice model that you want. That's not a reasonable choice for people. So then some more back and forth went on, and eventually the federal government said, okay, Vermont, you have to write a plan telling us how you are. And I think probably, I have no evidence to the contrary, Vermont is like the last state to comply with this rule. You need to write a plan telling us how you're going to do that. You're going to tell us how you're going to actually change your case management services in all 5 of your programs, but we're talking about the one called Developmental Disability Services today. And the state wrote that plan and they said, yeah, could we have 5 years to do that? And the federal government said, no, it's been 9 years. You need to do this in 3 years, not 5. So that's the situation Vermont is in right now. It's under what's called a plan of correction, which is a formal agreement with the Medicaid authority that says, yeah, we're gonna fix this problem on the timeline that the federal government has approved, and we're gonna come into compliance by, I think it's 2025, at some point in 2025. So Vermont didn't feel it had the capacity to do that with existing staff. This is pretty common. And so they hired an outside consulting firm called Health Management Associates. And the key person there is a woman named Sharon Lewis, is our consultant that we're working with, and her team. I've known her for a long, long time. She used to work for the same federal organization that DD councils report to. I have a lot of trust in her knowledge about how other states do a good job in delivering case management services. Okay, so that's all kind of the background. Sue, have I missed anything important in that story? Okay, all right. I'm gonna go to what has the state announced recently? Well, it's kind of not a lot of information. It was treated as this big announcement, but they haven't told us a whole lot. So Health Management Associates has done some had some conversations with all kinds of stakeholders. I sit on an advisory committee to the process. They've interviewed a lot of providers. They've published a paper that says, yeah, Vermont really has a bad problem with conflict of interest and they need to fix it. And, here are the ways that it looks like it has to be fixed. And they have now put forward a proposal that says, here's how we're going to structure, here's step one that we're going to take to fix this case management problem. And the announcement is pretty short. So it says that in developmental disability services, the state will contract with.
Paul, I'm going up to watch the rest of this on the computer.
somebody
Okay.
might need to mute. Thanks. The state will contract with up to 2 organizations that deliver case management statewide for developmental disability services. So what's important there is the state's gonna thinks what it wants to do is the state doesn't want to deliver case management services. That was on the table and the state said, no, thank you. We don't have staff for that. We're not going to do that. We're going to write a contract and we're going to get 1 or maybe 2 organizations to come forward and say they're going to be the case management organizations for developmental disability services. And the way we're going to find those organizations is the way we normally find contractors. We're going to use the state's request for proposal process, which means that the state's going to write a pretty detailed description of the work they want an organization to do. And they're going to put it out so that anybody in Vermont or nationally, could be a national organization, can provide Vermont with a proposal about how they would deliver this case management service. Okay, so what's wrong with this picture? This is what we want to get to here. There's a lot we don't know. And the state has put out this statement, and they're going through a whole big process now where they want to know what you, the public, the recipients of service, think about their big idea of putting out. Sorry, I shouldn't try to make it funny, but they want to know what you think about this proposal that they're going to write these contracts and put this work out to bid and write these contracts. So here's some things that I think before you comment on that, and they're inviting your comments lots of different ways. There's an online, there's a link at the end of this talk, but there's a form you can fill out. You can attend a couple of online meetings and make comments. You can go to in-person meetings there's different locations, Burlington, St. Jay, Rutland, and Bennington. Or you can just write them a letter or a note or however you want to let them know what you think. So this whole talk here is because Ms. Lewis, the consultant that's working on this, really thought it was pretty important that the DD Council step up and help families and self-advocates comment and share what's on their mind about this proposal around case management. So here are some things that you might want to think about as you think about how you want to respond. There is a whole lot of stuff we don't know in that proposal. So, for example, what exactly does Vermont mean by case management? How are they going to define the work that this new entity or organization or 2 is going to do? They haven't actually defined that. The fancy word is scope of work, the things that organization's going to do. And in fact, the federal government, when they wrote this new rule, they didn't define case management either. So there's a lot of fuzziness going on about what that would actually mean. And then there's this other term that you're more familiar with called service coordination. And a lot of the agencies are saying, your designated and specialized service agencies are saying, well, service coordination is really, really important, and we still want to be coordinating services, and we need to be paid to do that. So how is the state going to tease out the things that the designated agency should do and the things that this new case management entity should do. They need really clear guidelines about what that's going to look like. And it's hard for me to imagine anyway, because I write these kinds of requests for proposals all the time. You have to be really, really specific when you put those proposals out there. You have to say really clearly what it is that you want someone, what is the work you want someone to do? And the state has yet to define case management versus service coordination. How many people would the case manager work with? So, a case load, that's the fancy word for how many people is a case manager working with, right? A caseload of 75 is really burdensome. A caseload of 20 is manageable. I don't know what the right number is. I really, don't have an idea about that. But that's something the state can regulate, and it can say, even when it's asking for proposals in this request for proposals, how many on average are you thinking that is a reasonable amount of people for a case manager, whatever they're going to define that as, to support? And the quality of the service that person's going to be able to deliver to someone has a lot to do with how many people they're trying to
Will
support.
they be regional? Are we?
So notice that the proposal the state is put out is for up to two, which could mean one, up to two statewide organizations. Now, I think that's problematic, so I'm going to get to that in a second.
Okay.
So
this is going to work.
Another question, right, is how is the state going to ensure that case management services are high quality? Like, what are the quality standards? You're going to define the service, and what are the quality standards? What are you doing to say this is a quality service? And how much are you going to pay for it? Typically, when you put out something and you ask for proposals, you say, we have this much money. How can you do it for this amount of money? Right? So how much the state is willing to pay for case management and how they define it is kind of the questions that it should be deciding first before they actually ask who's willing to do the work. So that's one set of questions. And then the next set of questions that I think also, and I think the Julianne kind of alluded to this, right? Why up to two? Why is two the special number? I mean, let's remember that there are 3,334 people receiving developmental disability services. So even if we were lucky enough to have two contracts with statewide organizations, each one of them would presumably be working with 1,000 600, and I can't do the math in my head, but a really big number of people, right? So, 2 is a pretty arbitrary number. So 40 is probably too many case management organizations, but somewhere between 2 and 40 is probably a better number than 2. And then why does it have to be statewide? Because I can think of a lot of entities that might do an excellent job regionally. So, for example, ARC in Rutland has a really high touch, close relationship to a lot of self advocates in Rutland, probably has no interest in serving statewide, but could deliver regionally really excellent case management services. All right. So, why does it have to be statewide? And then the last question I'm going to kind of put out there to think about is the council has said for a long time that you have to structure case management services differently. But that's not the only thing you have to do to ensure that people are not experiencing conflicts of interest. And the two main ideas we've put on the table is that there needs to be an ombuds office, like in the state of Washington, or in our Choices for Care program here in Vermont, where people who have smaller concerns about their services, like, hey, my provider says I'm not allowed to have coffee in the morning, or I'm living in a vegan household and I don't eat vegan, or whatever it is. Some of those smaller issues can be dealt with through an ombuds office. right? Something that we haven't had access to in developmental services. Another component would be independent options counseling, some place that you can trust that's going to give you independent information about what all your options are. Again, that exists in the Choices
Person.
for Care program, but not in developmental services. Go right ahead.
Um, Karen Price put a question into the chat.
Super.
Um, is this for DS? What about the other programs?
Yeah. So, Karen, thank you for that question. So there are different proposals for each of the 5 programs. So there are 5 home and community-based service programs in Vermont. This is what they're proposing for developmental services, and I'm focusing on that here. Choices for Care has a little bit different menu of choices, and I don't even want to get into what they're doing with mental health services. But and I'm happy to talk to you offline about Choices for Care if that's of interest to anyone here. I just wanted to help people who primarily use developmental services to think about that particular program today. In general, the rule that there has to be that conflicts of interest have to be mitigated or dealt with applies to all 5 of Vermont's programs. It's just that they're taking a different path to how they're going to do that in each of the 5 programs. So last slide I'm going to leave you with. So you're going to hear, if you engage in this process, you're going to hear, especially from provider agencies, some pretty dire predictions like, oh no, there's going to be this terrible impersonal case management service that isn't going to know you in the way that your designated agency has always known you and been there for you. Well, okay, I'm going to leave it up to you to decide whether that fits with the experience that you've had with your designated agency. But anyway, that isn't the experience in every state. Like, it doesn't have to happen that way. So what could happen, and I'll get to your question in just one second, Beth, is that an individual, and this is like how it works in most states, right, works with a case manager who knows them really well, who helps them plan, who helps them get ready for their person-centered planning meeting, helps them write their service plan, connects to the providers that are going to deliver that, whatever in that service plan, and then checks, and this is really, really important and hasn't been determined yet, but I think is really important, checks to make sure that you are getting those services and the people that are supposed to deliver, those agencies supposed to deliver it, are actually delivering it in the way that you expected them to, right? So it's not just a one and done, we're just going to write your service plan, sign off on it, and leave you alone for a year. No, no, no. You have an ongoing relationship with the individual you're supporting. And you have some independence because you don't also have the home provider or the employment provider working for you. And then the person also has a relationship with their agency. And their agency does some other things, and some of them look like coordinating things, like they schedule who's going to come and help you, and they hire the direct support professional or the employment coach, and they send the staff, right? And you have kind of a relationship with 2 organizations, and that works just fine in other states. So, I really want people to not, I'm a little worried about a self-fulfilling prophecy here, where the agencies are saying, oh, this is going to be so impersonal. And then the state says, yeah, and we want 2 really large statewide organizations to deliver case management services, and we're not going to tell you what the caseloads of that arrangement are going to be. So maybe it would be really impersonal if you don't do it well. What we want is to argue for the state to the state that they have to deliver excellent case management services independently the way they're required to under the law. So I'm going to just, I will also put this link in the chat so that if you want to go online and get more resources about how you can comment, you can do that right here or sign up for one of the sessions that we're having. But I really want to just open it up for your questions now. I know that was a lot of information. So I'm going to stop sharing. And Beth, you had your hand up.
Yeah. First of all, I know you're recording this, is this going to be available to the designated agencies